Now, this is a urine. And if you look at this urine, the color, although the quantity is not enough, because in urinalysis, we are looking at a lot of things. This urine now, you are seeing now, can tell us a lot of things that is happening to our patient, right?
Yes.
So now, when we ask the patient to bring urine, there are reasons, there are things we are suspecting. Like some of you rightly said, diabetes, right?
Yes.
Pregnancy, kidney infection, urinary tract infection. It can be reviewed too. Yeah. And it can also tell us if the kidney is being damaged. And for our level, what we use is combine 9. That's combine 9, that's combine 11, that's combine 2. The only difference is that this one, when you count here, 1, 2, 3, 4, 5, 6, 7, 8, 9, it's called combine 9. Then the one that's combine 11 is 11. The one that's combine 2 is 2. There are very important things you must remember. There are very important things you must remember. One is, before you use this thing to test urine, you must check the expiration date. You must check the what?
Expiration date.
Because if it has expired, that means it will give us a false result. To test different parameters. One, we are going to test, the first one there is nitrate. Second one is urobilinogen. Third one is protein. Fourth one is pH. Fifth one is blood. Sixth one is ketones. Then bilirubin, followed by glucose and ascorbic acid. All of them here has their duration. They must stay. You understand? For you to read out the results. So that's why you must also, the first thing I said, you must check the expiration date. 2, you must check the manufacturer's instruction. Here, he said for us to get nitrate, it must stay 60 seconds. When we dip and remove, it must stay what? 60 seconds for it to read. Therefore, urobilinogen 60, protein 60, pH 60, blood 60, ketone 45 seconds, bilirubin 45 seconds, glucose 45 seconds, ascorbic acid 45 seconds. So
it is important to take your reading of the test at the exact time in order to avoid false negative or false positive results.
And because this urine is a suspect.
Yes.
So you must cover your face. Yes. Because in the process, this might splash.
Yes.
So these are safety precautions. Then, waste. You understand? Where we put it at the end of it all. You dip it this way. Then you tap excess off. When you tap excess off, you keep it. Are we together? Remember the time range, 60 seconds. So we must allow 1 minute to go before we read it. Are you together with me?
Check the data
Rest on this thing. Don't allow this thing to touch the container. Remember this urine might be infected, so it doesn't infect this thing. So use your index against it.
So
you need to compare it. I also do this way.
It's the prevalence that we track. Hit the threshold, no turning back. Intervention and the contact tracing. Yeah, the whole community health is what we face.
We look at urine color. It tells us about biochemical processes that's happening in the body. Now, let me tell you, normal color of a urine is pale yellow to amber. We call it pale yellow. What leads to that color is as a result of urobilin, which is a breakdown product of hemoglobin. And every human being that is living, there must be breakdown of red blood cell after 220 days. Another parameter we also look at in urine urinalysis is appearance of the urine. The normal urine is supposed to be clear. Are we together? It's supposed to be clear. So when it's too big, that is, when it's too big, it shows that there could be cells, bacteria, crystals or protein, or there could be pores in the urine. And what are the causes of cloudy urine? Infections and inflammation. Infections and what? So when the urine is not clear, it could be that the urine has pores, or the urine is having there's inflammatory disease occurring in the kidney that's making the urine not to be clear. Are we together? Another thing is that it could also be as a result of what we call lipiduria, excessive lipids in your urine. Excessive lipid in your urine, and that makes the urine to be milky in appearance. Excessive lipid in the urine makes the urine to be having a milky appearance. Are we together? Okay. So specific gravity helps us to know the concentration of our urine, and the normal range is from 1.005 to 1.030. 1.005 to 1.0030. It tried to tell us how our kidney is able to concentrate or dilute. When we talk about dilution of urine, excessive water is being added. So a high concentration of urine or a high specific gravity shows that the urine is concentrated. And this occurs in dehydration or glycosuria or proteinuria. Whereas a low specific gravity shows us that the urine is diluted, and this can be seen in diabetes insipidus. Are we together? Diabetes insipidus. Or it may also indicate loss of tubular function as seen in kidney disease, where the kidney can no longer concentrate or dilute urine beyond plasma osmolarity. Now the next parameter is urine pH. What is pH? Acidity or alkalinity of the urine. The normal range is within 4.5 to 8. Acidic urine is seen when the patient has what is called metabolic acidosis, or when you consume high protein diets. Are we together? When you consume high protein diet, or when the patient is having diabetic acidosis or diabetic ketoacidosis. Protein are not supposed to be seen in the urine. Even if present is usually small. Glucose is not expected to be seen in urine. Are we together?
Yes.
So though that it can pass from here, you understand, to be that, but it needs to be totally reabsorbed into the system. So when we begin to see it in the urine, it actually means that there's enough sugar in the blood already. So the body has to push it, which tells us about what? Diabetes mellitus. The next is ketones. Ketones are normally absent in the blood. They are normally absent in the blood. So if you see ketones in the urinalysis, it tells us two things. Either that she have not been eating. Yes. It's just starvation. Ketones are substances that the body produces when the body leaves glucose, because there's no longer glucose in the body to keep us sustained. The body will now start using fats. Bilirubin, I've talked about bilirubin, right? That it's usually absent. Bilirubin is from red blood cell damage. Are we together? It's usually absent in the urine, because it is being conjugated and passed through the stool as physics. So when it becomes when you see its excess, you begin to suspect maybe abnormal destruction of that. Now, blood in urine. Blood is not expected to be seen in the urine. When you see blood in the urine, we are going to suspect a lot of things. Either there's damage to this blood vessel because of hypertension, or parasite like schistosomal hematobium. Schistosomal hematobium. Because of schistosomal hematobium, it can damage this place, and this will start to bleed, and the person's urine turn red. Are we together?
Yes.
These are likely causes of blood in the urine, or hypertension. That means whenever you see red blood in your urine, you begin to think it could be that it's damage here. It could also be that you ask, are you menstruating to a woman? Nitrates are not sent in the urine. So when you see nitrates in the urine, it's a pure indicator that this person is having infection. Pure infection. Infection is from E. coli. Escherichia coli. Escherichia coli is common. It's common among women. White blood cells. White blood cells are not supposed to pass through here because here doesn't allow anything big to pass. So when you begin to see them in the urinalysis, it shows that infection going on in the what? In the body.